All right, let's dive right into our first topic, understanding the causes and risk factors of tonsillitis. Tonsillitis is a common throat infection that primarily affects the tonsils, which are those two oval-shaped pads of tissue at the back of your throat. These little fellows play a role in your immune system by trapping and filtering germs that enter through your mouth or nose. Now, tonsillitis can be caused by both bacterial and viral infections. The most common cause is the streptococcus, or strep, bacteria. But viruses, like the common cold and flu viruses, can also lead to tonsillitis. When the tonsils become infected, they tend to swell up and become inflamed, causing a range of uncomfortable symptoms and potentially affecting your overall throat health. There are a few risk factors that can make you more prone to developing tonsillitis. These include being young. Tonsillitis is most common in children and teenagers, as their immune systems are still developing. Frequent exposure to germs. If you're often around people who are sick, you're more likely to catch the viruses or bacteria that can cause tonsillitis. Having a weakened immune system. If your immune system isn't functioning at its best, you're more susceptible to infections like tonsillitis. It's important to understand these causes and risk factors so you can take steps to protect yourself and maintain good throat health. In our next section, we'll discuss the common symptoms of tonsillitis to help you recognize the signs and seek early treatment. Moving on to our second topic, let's learn about the common symptoms of tonsillitis. Recognizing these symptoms is crucial for early detection and treatment, which can help speed up recovery and prevent complications. The most noticeable symptom of tonsillitis is a sore throat. Tonsillitis is a sore throat. This soreness can be quite severe and is often accompanied by pain or difficulty when swallowing. You might even find that your throat feels scratchy or irritating. Swollen tonsils are another telltale sign of tonsillitis. When you look in the mirror, you may see that your tonsils appear larger than usual and may have a red or white coating on their surface. Swelling can sometimes make it difficult to breathe or cause a noticeable change in your voice. Fever is also a common symptom of tonsillitis. You might feel unusually hot or have a temperature above 100.4 degrees Fahrenheit. This fever is your body's way of fighting off the infection. Additional symptoms may include swollen lymph nodes in the neck, which can feel like tender lumps when you touch them. Bad breath, as the infection can cause an unpleasant odor. Headache, as the immune response can sometimes trigger head pain. A general feeling of being unwell or fatigued, which is common with infections. If you or a loved one experience these symptoms, it's essential to seek medical advice for a proper diagnosis and treatment plan. In the next section, we will discuss the various diagnostic methods and tools used by healthcare professionals to accurately identify tonsillitis and differentiate it from other throat-related illnesses. Now that we've covered the symptoms of tonsillitis, let's discuss the diagnostic methods and tools healthcare professionals use to accurately identify this condition and distinguish it from other throat-related illnesses. First and foremost, your healthcare provider will start by asking about your symptoms and conducting a physical examination. We'll take a close look at your throat and tonsils, often using a lighted instrument called a tongue depressor to get a better view. They'll also feel your neck to check for swollen lymph nodes. If your healthcare provider suspects a bacterial infection, they may perform a throat swab or a rapid strep test. A throat swab involves gently rubbing a sterile swab over the back of your throat, and tonsils to collect a sample of the bacteria or virus causing the infection. This sample is then sent to a lab for analysis. The rapid strep test can provide results within minutes, but it may not detect all cases of strep throat. To be more certain, a throat culture may be done, which gives results in a day or two. In some cases, your healthcare provider may also recommend a blood test to check for other possible causes in your symptoms, like mononucleosis or other infections. This helps to rule out other conditions and ensure that the appropriate treatment is prescribed. By using these diagnostic methods and tools, healthcare professionals can accurately identify tonsillitis and differentiate it from other throat-related illnesses, ensuring that you receive proper treatment. In the next section, we'll explore the different treatment options available for tonsillitis, including medications, home remedies, and lifestyle changes to alleviate symptoms and prevent recurrence. Let's move on to our fourth topic, which is exploring the different treatment options available for tonsillitis. Treating tonsillitis effectively is crucial for alleviating symptoms and preventing recurrence. The treatment plan depends on the cause of the infection, whether it's bacterial or viral, and the severity of the symptoms. If your tonsillitis is caused by a bacterial infection, your healthcare provider will likely prescribe antibiotics, usually in the form of oral medication. It's important to take the full course of antibiotics, even if you start feeling better before they're finished, to ensure the infection is completely eradicated. For viral tonsillitis, antibiotics won't be effective, as they only target bacterial infections. In this case, the focus will be on managing the symptoms and providing relief while your body fights off the virus. To help alleviate the symptoms of tonsillitis and speed up recovery, there are several home remedies and lifestyle changes you can try. Drink plenty of fluids. Staying hydrated can help soothe your throat and thin out mucus. Opt for warm or cold liquids like water, tea, or broth, and avoid irritants like caffeine and alcohol. Number 2, gargle with warm salt water. Dissolve half a teaspoon of salt in a glass of warm water and gargle for a few seconds before spitting it out. This can help reduce inflammation and relieve some of the pain. Use over-the-counter pain relievers. Medications like ibuprofen or acetaminophen can help reduce pain, fever, and inflammation. The common point: use throat lozenges or sprays. Sucking on throat lozenges or using throat sprays containing numbing agents can provide temporary relief from sore throat pain. Get plenty of rest. Your body needs time and energy to fight off the infection, so make sure to get enough sleep and avoid strenuous activities. Practicing good hygiene can also help prevent the recurrence of tonsillitis. Wash your hands frequently. Avoid sharing utensils, and steer clear of people who are sick to minimize your risk of catching infections. In the next and final section, we'll examine the reasons and criteria for tonsillectomy, a surgical procedure to remove the tonsils, and its potential benefits and risks for those suffering from chronic or severe tonsillitis. Finally, let's examine the reasons and criteria for tonsillectomy, a surgical procedure to remove the tonsils, and its potential benefits and risks for those suffering from chronic or severe tonsillitis. Tonsillectomy is typically considered when other treatment options have not been effective in managing recurrent or severe tonsillitis. It may also be recommended in cases where the size of the tonsils is causing obstructive symptoms, such as difficulty breathing or sleep apnea. Some of the criteria for considering tonsillectomy include: 1. Recurrent tonsillitis. This usually means having several episodes of tonsillitis per year despite appropriate treatment. 2. Chronic tonsillitis. When tonsillitis persists for an extended period, causing ongoing symptoms. 3. Peritonsillar abscess. A complication that can arise from tonsillitis where a pocket of pus forms near the tonsil. According to you, obstructive sleep apnea or breathing difficulties. Enlarged tonsils can block the airway, causing sleep disturbances or breathing problems. The potential benefits of tonsillectomy include a decreased frequency of throat infections, improved quality of life, and relief from breathing difficulties or sleep apnea. However, as with any surgical procedure, there are risks associated with tonsillectomy. These may include: 1. Pain and discomfort. Tonsillectomy can cause significant throat pain that may last for several days. Bleeding. There's a risk of bleeding during or after the surgery, which may require additional interventions. 3. Infection. Although rare, there is a possibility of developing an infection after the procedure. 4. Anesthetic complications. The surgery is performed under general anesthesia, which carries its own set of risks, though these are generally considered low. It's important to discuss the potential benefits and risks of tonsillectomy with your healthcare provider, who will help you determine if the procedure is the right choice for your specific situation. So that wraps up our exploration of tonsillitis, its symptoms, and the reasons some people may need a tonsillectomy. By understanding the causes, recognizing symptoms, and following appropriate treatment plans, you can effectively manage tonsillitis and maintain good throat health.